If you would like to have a consultation for rhinoplasty or any other procedure, contact us today. Our staff is ready and waiting to give you the best possible service. We are here for you. Hello everybody, my name is Tony Medina, CEO of Seoul Guide Medical, and today I've come to the skin clinic. I've come to the skin clinic to try to remove something that has started to recently bother me. If you're like 20 years old, you won't have this problem, but as you start aging a little bit, for some people it starts when they're in their mid-20s, some people in their 30s, but as you age, you start to get necklines that start showing up everywhere. And I was fine with it for the longest time, and then one day I was looking in the mirror and I'm like, you know what, I just don't like them. But I have worked in this industry for a very long time, and I know that there's only a limited number of things that you can actually do to get rid of lines around the neck. So I spoke with one doctor, and he recommended a certain type of treatment that they have in the skin clinic. So I'm going to test it out for you guys. It's my first time ever testing it out. If it's really good, we'll start recommending it to our patients. If it's not good, you will never see this video. I'm being taken care of today. Hi.
Hi. Okay, just follow me this way, okay?
Sure.
We'll head right onto the skincare room. So just come lay down here and place your items in the locker and take your shoes off and replace them with the slippers.
So, you seem to be the first English-speaking foreign qualisa? What's qualisa?
Esthetician.
Esthetician that I've ever met.
Right.
Hi. So, very interesting. Where are you from?
Well, I'm American by nationality, but I'm mixed Ethiopian and Romanian.
Ethiopian and Romanian. And I know that. Do you know how I know that? Because she volunteers at our NGO, Volunteer Korea. Right. And last time she volunteered with her mom and her brother. Your mom and your brother were picking up a lot of trash. You went to pick up trash at the river, and they were really, really cool people. So thank you, and thank you to your mom for coming. And very interesting, because I've lived in Korea for a very, very long time, and I've never had my skin done by anyone who's not Korean in Korea. So you are a professional, and I trust my skin to you.
I'll take very good care of you today, Tony. Okay, so first we're just gonna wrap your hair. Are you feeling comfortable?
Yes, I am. Thank you for asking.
Okay. I'm gonna put this towel over you so you don't get your clothes wet. So first we're going to start by cleansing your face. So I'm going to go ahead and get some water.
Okay. Start with that. I need a good cleanse. I've been out in the sun, and the sun always damages your skin. So I've been volunteering a lot these days with our NGO and playing golf outside and starting to play tennis again. Trying to protect myself from the sun, but it didn't work. So I can feel a lot of like damage, and I just feel kind of dirty. So please cleanse me.
Okay. So first I'm going to prepare some pads for the cleansing.
When I look at myself like this, I feel like a caveman. Like I feel like I got this ridge right here.
Right.
I think I have some Neanderthal DNA.
Isn't that normal for men?
I guess we're all kind of like Neanderthals a bit.
Alright. Okay, so I'm gonna start the cleansing. feeling okay for you?
Yeah, I almost fell asleep. It was so relaxing.
Okay, so I'm gonna do a first round of cleansing. I'm just gonna wipe off the excess cleanser.
I like how you're explaining each step in English. When I first came to Korea, I couldn't speak any Korean, so I could never do this kind of stuff because even if they were doing it, they wouldn't explain what they were doing, and that always scared me.
Right, so you kind of didn't know what you were doing.
Yeah. I had a really big mistake, I think my first year in Korea or my second year in Korea. I went to a skin clinic and I couldn't speak any Korean. The doctor couldn't speak any English. We were communicating via sign language, and I asked them to remove these dots from my face.
Right.
They grow as you age. And so they removed it, and I didn't understand that you need numbing cream beforehand. So they just did it without numbing cream. I cried.
Oh my god.
And then I also didn't understand the aftercare instructions where they're like, don't go out into the sun for like 1 or 2 weeks. And I went straight out to the sun and played football, soccer.
Oh my god, right.
And I got hyperpigmentation under here. It looked like tattoos. And the tattoo look lasted for about 1 year.
Oh my god. So
Yeah.
did you have to get any other procedures too?
It's nothing to do except wait until the hyperpigmentation goes away.
Right.
So if you remove anything from your face, make sure you don't go out and play football in the sun immediately afterwards.
Right, you have to follow the instructions of the doctor and the estheticians. Okay, so next I'm just gonna do a second round of cleansing.
Okay, she's calling this cleansing, but it also feels like a massage, so it's pretty awesome. I'm like drifting in and out of consciousness right now because it's so relaxing.
Are you getting the laser treatment today?
Yeah, from my neck.
Ah, is it the new machine?
Yeah.
Ah, okay.
Well, then my face is okay.
Right, so yesterday... We just started the machine yesterday, and I did that to the manager and me.
Okay. Toner me away.
Cleansed her face, and then I applied some numbing cream.
I always liked putting numbing cream on people. It feels so satisfying.
Really?
Yeah. It's like when I lather myself up before I shave, it just feels so good for some reason.
Because it's kind of like a thick and a little bit cold cream. So we're just gonna apply it from under your eyes to your cheeks.
Here's a tip. Always apply it exactly how you're applying it now. Some people apply it really lightly, and then the patient ends up like crying afterwards. So over apply.
Right.
Lots of Koreans like really thin it out, so they save a bit of money.
Right.
I don't like that.
Save money, but
increase pain. So why do you put on the oh, I look like Santa Claus. Why do you put on the foil after you, well, not foil, like
a plastic wrap.
like the plastic wrap? Why do you put on the plastic wrap after you put numbing cream on?
So we put on the plastic wrap over the numbing cream for the numbing effect to happen quicker. So it keeps the numbing cream insulated within the foil, so under the plastic foil, so that the numbing effect can happen way quicker.
Great. I really feel like I should have a razor and start shaving. So you just did something that is actually really useful. Can you explain it?
Right, so I just put these kind of wet cotton pads under your eyes. Usually we would cover the eyes once we set in the numbing cream, but I just put them under your eyes. Since I applied the numbing cream from your eyes down, I don't want the numbing cream to go up towards your eyes. That would be really bad.
Great idea, and this will allow me to spend 20 minutes with this on, but I can work at the same time. I am so incredibly numb right now. I can't feel anything on my face, which is a good thing actually, because I don't want this to hurt at all.
You can just lay down here with your head facing this way.
Alright. I'm excited to redo my face.
Can you scoot up a little bit more?
Sure.
Okay, perfect. I'll call in the doctor soon.
Okay, thank you. So, I thought it was just for the necklines, but I spoke with the doctor again and he said that it also does the face. So I guess this is going to help my face and my necklines. Fine lines and wrinkles go away. And this is...
So I'm gonna apply some gel first before we start the treatment.
Okay, so normally this kind of gel is a conducive gel and it helps the machine to work better so the skin is not damaged. And I can't feel even that, which is great. Just finished the treatment. I'll tell you how it felt. So I've done HIFU. HIFU is ultrasonic electrical impulses that shoot deep into your skin to lift and tighten the pores and to produce collagen. This machine also helps to produce collagen, but it doesn't hurt as much as HIFU. There's a very popular machine called Shrink, and Ulthera or Ultra Therapy. It doesn't hurt nearly as much as that level. It does sting a little bit in some places, especially if you have a bit of a beard or stubble going on. So a good tip if you're a guy is to shave closely before you come. But it did not hurt that much as I expected it to hurt. I'm a little bit red in some areas, but overall not bad. And I was speaking to the manager that actually did this treatment yesterday and her face looks fine. So hopefully by the next day everything will be fine. I feel good. It's been a week since my treatment and things are progressing smoothly. As you can see in the video, the doctor is resurfacing my skin. Now, there are different kinds of resurfacing lasers, but in general, with precision, they take off layers of skin. Your skin regenerates, heals, and it produces tighter, healthier, glowier skin. I'm not wearing any makeup or anything on my face. I just came back from the gym. It's early morning and I'm at the office now. My face is a little bit glowy, maybe from the heat outside and the humidity, but overall my skin is looking quite nice. The kind of laser that you need really depends on you. Some lasers focus on pigmentation. Some lasers focus on general resurfacing like I'm doing in the video. Some lasers focus on pores and others on wrinkles. It really depends. You need a consultation. All throughout the treatment, what I felt was pretty much nothing. I didn't really feel pain. I could actually smell a little bit of my skin kind of burning away, and that's a bit scary, but I'm used to it. That's normal. What are some possible side effects from this? Well, one thing you have to be aware of is that if you have darker skin, it will take longer for you to heal. Not all lasers are suitable for all skin types. There are lasers that are suitable for people with darker skin. People with lighter skin pretty much can have any laser they want, but people with darker skin should be a little bit more careful. If you get a laser that's too strong or just not the right kind of thing for you, it may take months and months for you to heal. In my case, I have a mid-dark, I guess, complexion, depending on if I'm tanned or not. And sometimes it takes me a little bit longer to heal. In general, people, that laser would be about 2 days who have lighter skin. With my skin tone, it took about 5 days for everything to kind of heal. If you were darker than me, it might take 6 or 7. This laser can be used by all kinds of skin tone people, but other lasers only by lighter people. And there are lasers that are for everybody. That's something that you should be aware of. Is it permanent? No, nothing is permanent. You know why? Because we age and you go out into the sun. But is it better than doing nothing? Definitely. Is it better than doing just skincare like a mask? Definitely. A mask, cream is not going to make your pores smaller. They're not going to reduce fine lines and wrinkles. They're pretty much just going to moisturize. The only thing that is actually effective at removing anything is treatments. So if you want to remove a mole, you do a laser. If you want to tighten your pore, you do a laser. If you want to reduce fine lines and wrinkles, you do a laser. Skincare is great, but it won't take care of those big problems. It just helps to maintain. Last, what kind of laser is right for you? Well, as I said, it really depends. If you want general kind of skin, glowing kind of look like glass skin, you probably want to start with a resurfacing laser. But if you're someone who has a lot of dots, well, you probably want to remove those dots if that's something that you want. If you want to have less lines and wrinkles and you have a lot of wrinkles, we'll try to ease those out first. So you may start with pores, or you may start with wrinkles, or you may start with pigmentation, or you may start with a general resurfacing laser. It's not that one kind of laser is best over another. It's really what's right for you, and that's why you need a specialist. In this video, you saw that there was a scan done. That scan is a great idea. Not all clinics have the scanning technology, but if you can get a clinic with a scan, that's great. Otherwise, the doctor will analyze you and tell you what he thinks or she thinks is most appropriate. If you guys have any questions, please write them in the comments below. We'll try to answer. Otherwise, contact us at consult@soulguidemedical.com, and thank you for watching.
Seoul is the capital of plastic surgery, skin, dental, vision correction, and other medical treatments. Soul Guide Medical is here to find you the best doctors, the best procedures, and take care of you from start to finish. Contact us at consult@soulguidemedical.com for a free consultation with our specialists. Let us take care of everything and create a customized treatment plan that is right for you. We help you with airport pickup, accommodations, in-clinic translations, aftercare, and hold your hand every step of the way. Visit our website at soulguidemedical.com for more information. Soul Guide Medical. Happy patients, always.